Well, state leaders know that Iowans want answers on why cancer rates here are going up. This is something that we hear all the time after Iowans found out in 2023. Our state is number 2 in the entire country for new cancer cases. Now, we just got a big look into the research that the state is working on right now. They're trying to figure out what's driving Iowa's high cancer rates.
There's not a day in my life that I don't know or get reminded that I have cancer.
Every year, more than 20,000 Iowans get a devastating diagnosis. Iowans like Lisa Beistlein and Maria Steele.
It kind of just rocked my world and was totally out of left field.
People who never saw this disease coming and who are still trying to make sense of it.
And I just sat there and said, I have lung cancer? I have lung cancer? I have no family history of lung cancer. I really felt there has to be a reason. Why me?
That question, why me and why Iowa, is one we hear again and again. And it's the question behind a sweeping research project at the University of Iowa. The study looks at Iowa's most common cancers and how our trends compare to the rest of the country.
We saw 2,582 more cases in Iowa than we would have predicted if we followed exactly those national trends.
University of Iowa professor Jake Olson says that includes hundreds of additional cases of lung cancer, melanoma, prostate, breast, and colorectal cancer.
While this report includes a lot of numbers and stats, we should never forget that each one is a person whose life has been changed by cancer.
Governor Kim Reynolds asked researchers to find what's driving those high rates.
Fully answering the question of why Iowa has a higher rate of new cancers when compared to the national average would require data from 20 to 30 years ago. And we would need data on each individual in the state, including what they ate and drank, where they lived, exposures to pesticides, chemicals, household products.
Data that isn't available. So Edith Parker, dean of the University of Iowa College of Public Health, says their first phase of research focused on behavioral and demographic factors. Things like smoking, drinking, obesity, insurance coverage, and education. What they found is complicated. Iowa shares many of those characteristics with nearby states. But even with those factors accounted for, Iowa's cancer rates are still higher than expected.
The people who don't smoke and don't drink and still got cancer are angry. They want to know why they got cancer, and we wish we could tell them, but on an individual level, it's just so difficult to be able to do that. We do know that on a population level, that these variables that we're looking at are highly associated with cancer rates.
That's Mary Charlton, director of the Iowa Cancer Registry. She says Iowa's cancer rates started rising significantly around 2014. Right now, the data doesn't show why.
Some of this can be just caused by variation in diagnostic practices of our physicians. I don't think that's what's causing all of it. I do think it's a contributor.
Charlton says some of the increase may be tied to how often certain cancers are screened for in Iowa, like prostate cancer.
Prostate cancer. That is the cancer that's pulling our trend furthest away from the U.S. It's a very common type of cancer, followed by breast cancer, followed by melanoma, and lung cancer.
For many cancers, Iowa's high numbers come from catching them earlier when they're easier to treat. That's true for breast, prostate, colorectal cancer, and melanoma. But lung cancer is different.
This is one cancer for which we are not like our neighbors. We have a higher rate and have had a higher rate for the entire time period that we looked at, and the difference seems to be widening.
In Iowa, lung cancer is more likely to be diagnosed late and more likely to be deadly.
It's hard to hear the statistics, I won't lie. It's a gut punch when you get that call.
For Reynolds, it's personal. Her husband was diagnosed with lung cancer in 2023.
Really hard to detect. And Kevin's, it's a fast-growing lung cancer, and I don't think probably if it hadn't metastasized to the spine and he was in so much pain, I'm not sure we would have found it soon enough. And Kevin doesn't smoke, has never smoked. He's, pretty trim and fit, so he is not somebody that you think would even experience that. But it is in his family.
Kevin's story, like so many others, underscores cancer's complexity. To look deeper at Iowa's problem, researchers mapped cancer rates county by county.
Our models predict that some counties had a significant higher than expected rate of cancer, which differs by type of cancer.
13 Iowa counties stood out, even after adjusting for behavior and demographics. 6 counties in northwest Iowa, along with Linn County, showed higher rates of prostate cancer. Tama and Johnson counties stood out for breast cancer among Iowans ages 20 to 44. Harrison, Warren, and Washington counties showed higher breast cancer rates among Iowans 55 and older. Researchers will continue focusing on those counties, looking at genetic and environmental factors like radon, water quality, pesticide exposure, and more.
We'll continue to look at all of the evidence, including environmental factors, and we'll act accordingly based on what the research finds. That's really, truly, the entire purpose of this study.
While the long-term answers are still coming, health experts say there are steps that matter right now.
Cancer outcomes are not predetermined.
Iowa State's medical director says Iowans should test their homes for radon, limit alcohol, avoid tobacco, protect their skin, and stay up to date on screenings. Alongside the research, the governor unveiled a legislative package aimed at cancer prevention. It would raise Iowa's tobacco tax for the first time in 19 years.
National statistics say that, 80% of lung cancer is caused from tobacco.
The tax was last raised in 2007, and Iowa's smoking rates went down. Still, 15% of Iowans continue to use tobacco. Reynolds' plan would also tax vaping products and includes new nutrition requirements for doctors, changes to food assistance programs, and a ban on certain dyes and additives in school meals.
Today's research findings make it very clear how important healthy behaviors are for the overall health and well-being, and my bill aims to really amplify that message.
For researchers, their work continues, with the next update set for July. For families living with cancer, these questions remain deeply frustrating and personal.
Our mission is clear: to address the issue of cancer as a whole and to save Iowans' lives. We need to expand cancer prevention, screening, and early treatment efforts.
While this study doesn't explain every why, the governor says it gives our state the clearest look yet at where gaps are and where Iowa needs to look next. I'm joined now by our chief investigative reporter, Suzanne Banky. And Suzanne has been, over the last year, digging into Iowa's cancer crisis. We were actually both at the governor's press conference. Suzanne, I think there's still a lot of frustration, right, with the data that we have right now, because there's not a clear answer what is driving Iowa's cancer. But both of us came out of that press conference saying this is a significant moment for our state. Why do we feel that way?
I think it's because we're looking for those answers, and I hear it a lot from people I interview. I hear it a lot from doctors who would like to be able to tell their patients things, and this is really the first big step that we know state officials and researchers are taking to get behind that why. What is driving that cancer rate?
We knew they put money into the study, but we didn't necessarily know, what questions they were asking or what different types of research they were taking.
Right. I think a couple of key things that came out of that press conference, and you highlighted them. One, we saw some answers, right? We know behaviors that we can modify and change. We know some of those key counties that are outliers in terms of being compared to national statistics, even with adjustments. And we also saw that the governor is willing to put words behind those dollars, right? Like, there's a bill out there. I mean, she's saying, let's raise a tax, which is not something that we've heard her say very often.
We don't often see that from Republicans or Governor Kim Reynolds in general. Another thing that was not included in that package, but both you and I watched the governor talk about this rural health care initiative called Healthy Hometowns. They're using millions of dollars from the federal government to try to tackle cancer prevention and treatment. What new information did we learn on that front?
We learned that there are 2 contracts specifically that will go to combat cancer in rural areas, and that Healthy Hometowns initiative is rural health overall, but a big chunk of that money is going to be based on cancer. And so we know that the Marion County Board of Health and we know that the University of Iowa will be key players in setting up some models that help bring services there and also screenings and prevention.
Right, and because part of what we heard was that Iowa is, so high in early cancers. People find, and when you are able to early detect, you're able to treat it more quickly. So getting chemotherapy and different things to places that don't have that right now.
Yes, and Another point that's been made over the past couple of years is that we do have high survivorship rates.
Right.
So that early detection is important, but getting some of those services out to the rural areas seems to be a really key thing that Health and Human Services Department leaders will be working on.
And I do want to note for our viewers as well, you heard there that lung cancer is different, that we're seeing higher mortality rates of lung cancer. The researchers did say that that is their next kind of focus, looking specifically at the profile of lung cancer in Iowa. Suzanne, another thing I wanted to ask you about, you've been talking to all of these doctors and advocates who've been asking you and asking the state for legislation because they say there are things we can do right now. And this past week, we saw some actual bills pop up at the State House that reflected what doctors have been asking for. So what did we see?
Well, first of all, the governor's bill about the tobacco tax. That is something that has been asked for a while, actually probably since 2008, to be honest. But we also saw a bill this week get some attention on restricting minors' access to tanning beds. Now, there was an amendment added that would allow parents to offer or to give their consent, but still, we know that UV rays are a cancer risk or a risk factor for melanoma and skin cancers. And so that was another big one. And we also know that radon and radon mitigation is getting some attention. So maybe that doesn't seem like it's related to cancer, but it's a cancer prevention step.
For our viewers who may not know what radon is,
Sure.
high-level summary, quick.
It is a colorless, odorless radioactive gas that exists in our soil, and we are the highest in the country for it.
Now, I also want to know that we just kind of scratched the surface, right, with the research that's out. We have 30 seconds left.
Sure.
How much time, does this study have?
So that $1 million is funding research over 2 years. The next phase is to look at environmental factors and genetics. The idea is we'll get a report of some kind on the findings, maybe something similar to what we saw this week, in July.